Thank you for watching the World Coommunity Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
And good evening to everybody, everyone. I'm your host, Ed McQueen. This is WCM Live. And of course, Miss April is standing on the left over there. Anxious to get started. We're all anxious to get started. Anytime you're talking about our health-related items, we want to do that. So, April, everything's all right over there?
Yes, everything is fine. Yeah. Can't wait to dig into this great information tonight.
Absolutely, absolutely. We got the right person to talk about it from a literary case anyway. We got somebody, April, who's been guiding under guidance of our local physician, Dr. McIver, for a while. And he's going to talk to us all about all the things that he's learned and all the literary research that he's been through, and he's ready to convey it to all of us. At least I'm ready to be the recipient of that. So the question became what your labs really mean. We said beyond the numbers. Labs, we're talking about our blood. We get our blood tests. The doctor subsequently starts narrating to us and explaining to what each of the things are when you go to him after he's done your analysis. But we have someone today who can kind of carry us farther into that, and he's also written in the magazine. And when he's none other than, well, first of all, April. Can you tell our audience about what logistics are in terms of how they can stay tuned with our chat line and all that kind of stuff? And yeah, that's up to you. I mean, you're good at that. I'm sorry. I must have been talking too much. Maybe I'm anxious to get into this. I don't know. I kind of skipped that. Yeah. So.
Yeah. Well, if you are joining us tonight, thank you so much, first of all, and we appreciate all of the support and continued engagement. So we want you to, of course, interact in this conversation. You can drop comments in the chat if you are on Facebook or YouTube, and we will share the comments with our special guests and also the questions. If you have any questions about the topics that Kristen Newman is going to cover tonight, One of the things that we asked him to cover, it was kind of spur of the moment, but I was like, if he can give us any information, I think it's important for us to know. There is and I don't know if I'm saying it right. He will correct me if I'm wrong, but there's a cyclospora parasite that is affecting our fruits and vegetables, and has everybody feeling a little, anxious about buying fruits and vegetables and eating them now that there are all these alerts about this bacteria. I personally purchased some cherries yesterday and some strawberries. And Brother Edward, I probably washed the color off of those cherries and strawberries because I wanted to make sure that we didn't have problems with the cherries and the strawberries. But I'm still a little anxious about eating them, right? So Christian is going to share with us just some, a little bit of information about what this parasite is all about, and then give us some tips on how we can make sure our fruits and vegetables are clean enough to consume. And then after that, he's going to get into the topic of the night, beyond the numbers, what your labs really mean. And I know that this is going to be, an interesting topic tonight, because I don't know too many of us who have not had some kind of blood work done. And, just like, we go for these routine tests and we get the results and we're like, but what does it really mean? And so he's going to talk to us tonight about how to better understand our results and the important role that lab work plays in maintaining long-term health. So without further ado, we have Mr. Christian Newman. Hey, how are you?
How we doing? Doing well.
All right. It's good to see you.
Yes, ma'am. It's good to see you too.
All right. So I've already kind of set the stage. You can start wherever you like.
Yes, ma'am. So like you said, I wanted to go ahead and just introduce the topic. I'm going to be talking about labs, blood work, if you will. My experience in that is monumental, actually. So it started in family medicine, where I got to see routine labs, got to see longevity of labs. And then it continued in emergency medicine, where I got to see more fast-paced labs where the phlebotomist can get it quick, obviously, because it's more emergent. So I'm super excited to talk beyond the numbers and what those numbers mean. And like you were saying, I was researching this. So it's a parasite, not a bacterium. It's called cyclospora. And I was like, because I saw something on the news or anything, I saw like it causes like explosive diarrhea. I was like, what is this? That's one of the symptoms. You can also experience stomach cramps, a loss of appetite, weight loss. But the biggest thing about it is that fruits and vegetables are obviously like it's an important part of our diet. So although it's a little bit questionable, like this parasite that might be happening, it can still reduce the risk of heart disease, stroke, diabetes, high blood pressure. Just like COVID, it's still like unknown of the cause, because it's caused from contamination, but it's still like it's just hit or miss. So it's super hard to kind of like digest how it can kind of come about, if that makes sense.
Mm-hmm. Makes a lot of sense.
Yes,
yeah.
Ma'am.
And I noticed that like there was one article that mentioned it was apparent that it was kind of linked to like green leafy vegetables, but then I read something that said berries as well, and that made me kind of like, ooh, okay, I just bought some strawberries. What do I do? But it mentioned cilantro, lettuce, spinach. They're cautioning people about buying like the salad mixes in the bags. Mm-hmm. So, if you know anything about that, share that with us as well.
Yes, ma'am. So like you were saying, the research that I found, the leafy greens, the basil, the parsley, actually, snow peas, other fresh herbs, lettuce, like you said, the lettuce packs, once again, other leafy greens. And my advice for what people should do is, like I said, continue eating fruits and vegetables because it's important for our diet. And like you said, keep on washing those fruits, like you said, until the color comes off. Especially wash your hands before prepping food as well, because I know a lot, like when I'm in the kitchen, like I'm touching this, I'm touching that. So cross-contamination is a real thing. Refrigerate your fruits, vegetables promptly, and obviously just follow the FDA and the CDC recall notices if a specific product is identified. If you develop persistent diarrhea or stomach cramps or nausea after eating fresh produce, contact your health provider, and if needed, go to the emergency department. But we need to continue eating these fruits and vegetables because, once again, it's important for our diet. But like I said, just wash them thoroughly.
Mm-hmm, mm-hmm. Yeah, I would. I agree with all of that, and even like the convenience of the salad mix bags. Sometimes people just open them up and they just start putting them in bowls. And I'm not even sure if restaurants are, they may be using those types of salad mixes. I don't know, but it would probably be in the best interest of everyone's health if you're going to use those bags, open them up, inspect them, actually take them out of the bags, look through them. I don't think it would harm to give a quick rinse or whatever you got to do. But since it's hit as like a hot item right now, I think everybody needs to be mindful and be careful about going into the stores and picking a little something up just to see if it's 100%. Sweet.
Yeah. I'm good at that. So I'm like, yeah. But you need to know that before you start buying it. I mean,
you do.
Yeah.
You get grapes sometimes that end up being sour, but and all those things that you're capable of just putting in your mouth. I mean, of course, I always carry my little napkins to kind of like wipe off before I even, But at the same time, you want to know what you're buying. If that opportunity exists out there, you just don't want to just grab. I've seen people just grab a bag of cherries, a bag of grapes, just put them in the cart. I mean, they don't want to taste anything, but when you get home, you never know. Okay, exactly. I had bad taste in all of them. Okay, so you don't want to be wasting money in that regard.
Yes, and when it comes to like the supermarkets that I mean, I typically buy my fruit from Publix because it's known for its strong quality, or even Costco or even Whole Foods Market. But once again, even fruits or vegetables there could be contaminated. So like you said, the best safe practice is because we made some chicken Caesar wraps and we didn't even look at the lettuce because it's not normal. It's convenient because we just open up the lettuce. Just open up the lettuce pack and then just put it in the wrap. But we need, just put it in that colander, rinse it down, and then do it. But once again, since it's convenient and since a lot of people, we're busy, right? So but it's still important to wash them thoroughly. That goes with everything, every single food, whether it's protein,
especially for lettuce. Yeah,
exactly.
Especially for lettuce, man. I've seen more bugs than enough. I'm talking about the ones that are crawling. I've seen the little bugs more than enough, and they're just, you can't clean them good enough. That's what I'm saying. So let me ask you, Christian, about the a commercial I've seen on the internet regarding the cleansing of fruits and vegetables, and they demonstrated that by this gadget. Of course, they were trying to sell this this gadget. They were using, to a great extent, it made sense, and they put the in this case was strawberries, I believe. Put them in a bowl of water, and then they put this gadget in, and this gadget started dispersing some kind of air or whatever, or enough pressure to dislodge all of the hidden dirt or whatever, and subsequent discoloration of the water as a result of this being in there. Do you think that's true?
See, I mean, once again, like those commercials, those gadgets will always get you. And while some of those gadgets may reduce dirt or some microorganisms, I wouldn't recommend them because, I mean, at least with my research, I don't think there's enough evidence over proper washing with your hands. And most public health agencies do not recommend purchasing these devices. So me personally, I wouldn't do that. I would just simply wash it with your hands, and obviously don't wash with dish soap, laundry detergent, not like that. Just running water. I would recommend that over these gadgets because those gadgets, like, you can have different you can put microplastics in your food. So there's pros and cons to both.
Yeah, but the food wash that's been on the shelf for many years, and that's been selling. So obviously that has some proof to it that that part works when you use a fruit wash.
Yeah, I use a fruit wash. I have I'm not gonna say the name brand. They need to pay us. But I use a fruit wash because, especially when I get cucumbers or anything that's really glossy and waxy, you can almost feel the wax on it that they put on there. I think I call it cosmetics because they try to make it seem like it's as fresh and high quality as possible. But something as simple as using vinegar in the water or vinegar and baking soda. And, like today, I used the fruit wash, but I poured a little vinegar in a bowl of cherries submerged in water. with the fruit wash and the vinegar, and I did the same for the strawberries, and I just let them sit for maybe about 5 or 10 minutes. Just kind of agitated them a little bit, and then poured the water off, and then did a couple of rinses because I wanted to make sure to wash off what it had been soaking in. And so what I noticed is that there was, the water had turned a little pinkish from the strawberries, and the cherry, the water that had the cherries was a little cloudy. And that means that, there's some dirt and residue or whatever that came off with that. Right. So as I'm rinsing them under the faucet, I'm just kind of rubbing them gently.
Yeah, absolutely.
And then, drying them off. But,
so I agree
you can do something as simple as vinegar and baking soda and it'll work. Yeah.
And I would agree with that. It's just the gadgets. Like I wouldn't recommend that, but like any type of fruit wash, of course, that will remove dirt. Like you said, waxicides, those small microorganisms or pesticides, or even surface contaminants. Because people will just pick up stuff in the store, and some people just eat, and just thinking about those little things as well. Like people just pick up apples or grapes or different types of vegetables, tomatoes, and we just go right into eating them. But once again, those surface contaminants. So it's super important, like you said, to use those type of washes. I'm certainly going to have to do more research on that too, because that's super interesting.
Yeah. Well, Christian, thank you so much for pulling that information together so quickly. And I thought, that since there was a thread actually that was happening on social media with a little discussion about it. And so I hope that this information has been helpful for anyone who's listening and worried about or concerned about what's going on with the Cyclosporia parasite that is affecting the fruits and vegetables. So. Well, anyway, we are here to talk about beyond the numbers, what your labs really mean, and the importance of lab work for long-term health. So, Christian, take us into this topic.
Yes, ma'am. And I'm super, super excited to talk about this because I've learned so much about lab work ever since I gotten into healthcare. And just to kind of start off, I'm going to just list some of the names and abbreviations that you probably heard before. So we have a CBC, which is your complete blood count. It looks at your red blood cells. You probably heard the word anemia before. That's with your hemoglobin. There's your basic metabolic panel and your comprehensive metabolic panel. Your basic metabolic panel and your comprehensive metabolic panel. They basically look at the same things, but your comprehensive metabolic panel looks at your liver enzymes. You then have like your lipid panels, your hemoglobin A1C to test like if you're diabetic or not. You have thyroid fasting tests such as your TSH, which checks like your thyroid. So if you have like hypothyroidism or if you have hyperthyroidism, hypo means below and hyper means above, by the way. And you have urinalysis as well it can detect protein, it can detect urinary tract infections. You also have your vitamin D levels, your iron studies, like I said, for anemia. So those are kind of like your main labs that you'll get in the family medicine. And I learned so much, and I'll keep on rambling about Dr. McIver because he's just amazing. And I learned so much. I even got to test some urine tests. I even got to look, just learning the labs was super cool to me. And I walk in my primary care. And then, like I said, as I talked in the beginning about emergency medicine, so you're going to see more of your emergent labs, such as your D-dimer, which tests for pulmonary embolism, which is blood clots in your lungs. You'll see C-reactive proteins. You'll see PSAs more in your family medicine, and that's your prostate-specific antigen. So that's checking to see if you have prostate cancer. So there's so many labs out now. It's tellers. And it's super important to know, once again, like the title says, beyond the numbers. So you get this red flag so you'll probably have like a patient portal. I'm sure everyone has a patient portal where you see specific numbers and everything like that. And you see those numbers, you're like, what does that mean? What does that mean, right? So you ask your doctor, and sometimes they explain it thoroughly, sometimes they don't. So it's super important to know about that stuff, and I'm super excited to talk about it.
Wow.
So is there like a standard time period or duration where doctors determine blood work is needed? For example, if you go to the doctor every 3 months, is it necessary to have blood work done every 3 months, or is it really more specified if you have a condition?
Yes, ma'am. Super good question there. And It's the latter. It's specific on the condition. So me personally, out of full transparency, I have hypertension. So, and I also have gastroesophageal reflux disease. So I get labs done. I get my hypertension lab done. I get my CMP to just make sure that my medications are abiding by those. But healthy adults with no major medical conditions, they often receive routine blood work every 6 months to a year. But people with more chronic conditions, such as diabetes or hyperlipidemia, which is high cholesterol, they get theirs checked normally every 3 months. Just to make sure to see if levels are either going high or if a patient needs to put on medication. It's super important. And in the emergency department, like I said, those can be checked within hours. They can be repeated multiple times. For example, you can get a troponin checked, which checks like your heart enzymes to see if you're having a heart attack. So it just varies. Like I said, it's the latter. If patients have more chronic diseases or they have more acute conditions, then those conditions will be tested a lot faster than healthier individuals, for sure.
I know as diabetics, it's like every 3 months.
Yes, ma'am.
Testing the A1C to
Yes,
see
ma'am.
where it falls. Okay.
Yes,
All
ma'am.
right.
Yes,
Yeah.
ma'am. And that A1C is, go ahead. Sorry about that.
No, go ahead. Go ahead.
Yeah, so just to kind of expand on the hemoglobin A1C, so it reflects your average blood sugar. So this was super interesting to me. So it affects your kidney function. It also, so pre-diabetes between 5.7 to 6.4, and diabetes is 6.5 or higher. So that was super cool to learn about because I didn't know like the actual values. So they'll probably put you on, diabetic medication, whether it's insulin, whether it's different types of medication there. So metformin, as we all probably know about. So it's super important to just know those values to know whether to consult your doctor or not.
We have Priscilla Fuller. Thank you for watching tonight. She said, thank you for this valuable information. Please include in your discussion how individuals can advocate for themselves with their medical doctors.
Yes, and that's super important. And it's super, when I become a physician, hopefully, just like Dr. McIver, just talking to the patient and talking to the physician thoroughly and establishing trust, I think is super important to start off with, because you're not going to talk to a physician if you don't trust him. So do not be afraid to ask what your results mean. As physicians, encouraging patients to ask, can you explain this result? Is there something I should be concerned about? Is this a new change, or has this been happening over time? What does this mean? And patients should do their own homework as well. They need to know their family history. They need to know if their mom or dad had a hypertension. They need to know if their mom or dad had diabetes. They need to know their previous diagnoses. They need to come in with all their medications that they're taking, if they have any previous surgeries, if they have any allergies. And they need to also keep track of their numbers, because as doctors, they have a patient record. So it's called a history of present illness. It's called, and they can see different measures, whether it's your blood pressure, whether it's your A1C. They can see previous appointments. So you need to keep track of your own numbers, even though the physician will have your numbers. Keeping a track with your own numbers is also important. And when it comes specifically to your question, Ms. Priscilla, thank you so much for that. Advocating comes in with bringing that list of questions as well. Write down your concerns, write down your symptoms, bring your medications, bring your questions, and talk about different barriers to care as well. Like if you have medications that you can't afford, tell the physician that. Tell the physician about the cost of the laboratory testing. Tell the physician about if you can't make the labs because of transportation or difficulty understanding instructions or challenges making your appointments. Tell your physician that, and encourage patients to mention your new symptoms, changes in appetite, changes in energy, weight changes. So just once again, just be fully transparent, because the physician's not going to know if something's going on if you're not being fully transparent. So be fully transparent, especially with your family medicine and primary care doctors.
I think that's a very good point, and I like the the question about advocacy. Just like you said, in transparency, and I think it's great if we share our lived experiences with our audience so that they understand that we too go through all the things. But there was one time when I questioned my vitamin and mineral level. levels. And thank God that I have a wonderful endocrinologist who is a listener and is not dismissive. She listened to, my theories, no medical training, nothing like that. But you know how your body feels, right?
Exactly.
Only you really know how your body feels,
exactly.
the ebbs and flows and the things that go on night and day. And so I spoke with her about, something that was pretty much stagnant in my blood work. There was a number that just would not move. And I read that it could be that I needed to add some kind of a vitamin or a supplement. So I asked her about the addition of vitamin D, because I knew I had problems with, maintaining like a normal level of vitamin D in the past. And she said, you know what, April, let's take a look at that.
Let's try it. Right.
She does the blood work and finds out that not only was my vitamin D low, but it was almost low as in off the charts low, as in negative. And she said, that could have some bearing, but also, how are you feeling? She also talked about how, melanated people have a tendency to have lower vitamin D levels, right? So I was prescribed a vitamin D capsule that I had to take once a week, a very high, I think it's called IUs or UI, or what is it, international units or whatever. And when I went back for my next exam, the number that was stagnant actually lowered, and that's what we wanted. That's what we wanted. Yes, and the only thing that changed was the addition of the vitamin D.
That's crazy. And that, like I said, just a lot of these labs kind of intercorrelate. So if you see like a number here and you see a number there, it's crazy how that can affect that. That's just that's why it's so interesting just to kind of talk about. And I guess I can kind of talk about vitamin D. So the normal levels are 30 to 100 nanograms per milliliter. And I'm assuming like some of the symptoms that you're receiving, that you were probably having, was like muscle weakness or some type of immune dysregulation. And those levels can be improved by vitamin D3 supplementation or dietary intake, such as like fatty fish, or even just safe sun exposure. Like that's crazy though, how like the levels kind of intercorrelate like that. It's super
exactly. And I mean, when she came in, and I'll even say that it was my A1C that was impacted in a positive way. And so, she says, at this point, I just recommend that you go with a vitamin D3. Make sure it's 5,000 IUs or UIs or whatever it is, so that it can be effective, because you aren't getting it from, the natural sources. I guess you get it from food, but you mainly get it from sunlight. And I can't be exposed to sunlight because of certain medications for extended period of time because of certain medications. What I will say is that, even through that bit of lab work, and adding vitamin D plus K2, to my vitamin regimen or whatever, I do feel better. And and I think that, like I said, it positively impacted other things in my body. And so, being an advocate for yourself, and especially when you have a physician who's willing to listen. And, even if it was something that she thought was just like, that's a long shot. At least she said, well, you know what, let's just take a look at it. Let's just take a look at it and see,
And
that'll put my mind at ease.
Yes, ma'am. At the end of the day, patient comes first. Like,
that's right.
We're there to treat the patient. So like you said, your body. If there's something happening, let them know. Like I said, they're not going to know unless you tell them. So like if you have a doctor that's listening, like Dr. McIver, like a lot of the physicians in the Conway area, a lot of the physicians in the Myrtle Beach area, then just let them know and be transparent. Or else, once again, they're just not going to know. So just be transparent. That's my ultimate advice for that. Yes, ma'am.
Yeah.
Yes,
so,
ma'am.
So what would you tell? At what age would you recommend someone really started going to and getting annual, not just annual, but checkups as often as they possibly can? I know at one time the restrictions was the fact that people didn't have enough money. I mean, to go to a doctor and get a checkup. But I think they're pretty much flexible today. And even if whatever your income is, I think that's available. I believe based on the number of insurances or that the appropriate insurances that are out there. So what would you advise people if you had the ability to tell each person or have each person to give you a call and say, Doc, well, not Doc, but
Yes, sir.
Mr. Newman, I'm going to the doctor tomorrow,
Yeah.
and I'm going to get my checkup, for lack of a better word. Okay, and so what should I ask my doctor? Okay.
Yes. Yeah. So really good question. And this is kind of certainly a good segue into where do you even get your lab work done? So there are LabCorp is a super popular lab. Quest Diagnostics, that's what I'm familiar with. That's what Dr. McIver uses at Waccamaw Primary Care, or even a hospital-based lab. And I'm going to go age by age. So I have a primary care doctor. It's Dr. McIver, and young adults, 20 to the 30s. Even healthy young adults should establish care with a primary care provider and get lab work because common considerations, you can have a high cholesterol, you can have a high hemoglobin A1C. For adults age 35 and older, many providers begin paying closer attention to, like I said, as Black Americans, we have disparities in blood pressure, cholesterol, blood sugar, kidney function. And diabetes screening is especially important because early changes may occur before symptoms may even appear. For adults age 40 and older, this is a time when preventive care becomes increasingly important because our immune systems, as we get older, our immune systems, they decrease function. So providers may discuss different types of screening, different types of testing. For adults age 50 and older, this is important because I believe I talked about in the article, I talked about our PSA, and I touched on that recently, and that's the prostate specific antigen. And
Right.
it tests for prostate cancer. So for men, you need to get tested at ages 40 to 45. I personally have a family history of prostate cancer, and my dad is making sure to let me and my older brother know, like, you need to get screenings done, you need to get tested, you need to get that PSA done when you're around 40 to 45 because we have more of an individualized risk, and physicians know that. So getting that PSA done. At adults age 50 and older, important areas once again include colon cancer. It starts to build, as you can see. Like, you get those
Absolutely.
regular screenings as you're kind of younger, but as you're older, it builds. So when you're older, when you're 65 years or older, you start getting your metabolism tested, you start getting your electrolytes tested, you start getting your blood counts and vitamin deficiencies when appropriate. So as we get older, but that doesn't come to say, like, you can still get sick when you're younger too. So once again, just establishing a primary care provider at a young age will get that longevity of care, so they know, like, who you are and what your medical history is.
Right.
So you can kind of see that as you develop and get older.
Yeah, absolutely. Yeah.
Yes, sir.
Yes. So that has its pluses. Make no mistake about that. And the reason why I asked that question was because I think these things are happening too often, where young people, when I say young people, 30, 35, they tend to think that their age kind of knocks off their vulnerability in turn for certain diseases, which is historically impacted people in the 60s and 70s.
Exactly.
But we're finding today that age is really a number now in terms of getting to certain things. For example, like Alzheimer's. Okay, we're finding people who are maybe 50 in their 50s, 60s.
Mm-hmm.
Okay, so I think the science community is working on that very, very, very stringently, but I think it needs to be brought out a little bit more as to what's happening today and why we should be more cognizant of how to and when to start noticing things like that and start being aware of the symptoms, if there are some, if there are symptoms.
Really good point. And young adults should pay attention to prevention because, once again, like, your genetics play a big part into your health. Like, I have a family history of hypertension. So me knowing that as a young adult, I'm probably going to have hypertension when I get a little bit older. If your mom or dad has diabetes, there's a good chance that you may have diabetes. Family history. Yes, ma'am. So knowing that is super important as well for young adults. So getting tested is really important. That's why lab work is monumental for just healthcare in general, because those markers tell us something, and then we can start putting you on medication. However, I feel like it's important, especially now with lifestyle medicine. It's important that we don't put patients on medication right away. I'm a big advocate for lifestyle medicine. I feel like we should have a healthy diet. I feel like we should exercise daily. I feel like we should have good sleep. So that's super important as well for physicians to know is, even though we're experiencing these symptoms, we don't have to put patients on medications right away. And I remember talking about that when I wrote my article about pharmacology, is that a lot of times, a lot of medicalization happening nowadays, we just want to treat patients by putting them on medication. However, even though their labs may show something, we can see what they're doing, what their diet is, because their diet might not be great. Their exercise might not be great, so just maximizing that lifestyle medicine is super important to start off with before we start jumping to conclusions and putting patients on medication.
I'm glad you mentioned lifestyle medicine because I think that is also a topic that is in the forefront of people's concerns regarding health, and also with medicines being costly, insurance not really covering some essential medications. People are always looking for alternatives, and one of the things that at least I've heard a doctor or two say is that it will take some time for, like, as you termed it, lifestyle medicine to kick in terms of, for example, eating the right foods and certain amounts of foods you actually have to eat in order for it to make a difference. Now, I can attest that exercise can probably, kick in quickly some good results. But, when it comes down to food, if you are deficient in a certain vitamin, Christian, like, is there like an amount of time amount of food that you would have to eat in order to be able to see some positive changes, or is it just more about consistency?
Yeah, for me, I've always been a big believer of consistency, like just eating it depends on the type of person. And those small, consistent changes can make a big difference. A common misconception is that you have to completely change the way you do it. Like, it's easier said than done. Like, well, some doctors are like, yeah, just exercise 5 times a week and eat all the healthy, but it's not easy to just go from just, what you're used to change into a new lifestyle. It's not easy to do that. And realizing that as physicians, realizing that as patients yourself is super important. However, small changes can make a difference. The body responds to changes in eating patterns over time. Like, once again, it's a longevity. It's not going to happen overnight. Like, you're not going to see a lab number of a hemoglobin A1C of 7 to go down to 3 overnight. It's going to take some time. So you don't have to eat perfectly every single day. You can have a cheat meal here one day and have a cheat meal another day. But consistency matters more than perfection.
So what do you call a cheat meal?
For me, a cheat meal is kind of like, I'm a big Chick-fil-A guy, so a cheat meal for me is certainly a 12 count with a nice large fry. That's a cheat meal for me. Hey, I don't eat as healthy either. After I left Furman and after I've was an athlete there, we had to keep like a nutrition log, and we couldn't eat certain things. But now, I'm not really eating like I should be. That's why I'm probably getting a lot more lab work done.
So just think of it as the thing that you should not eat every day,
exactly,
or even every week. That's a cheat meal.
Exactly. Everything should happen in moderation. Like, even if you're eating too much fruit, like, that's not good. Even if you're drinking too much water,
it's possible.
like it's not. Everything should happen in moderation. So I don't. Oh, what were you gonna say, Cousin McQueen?
Yeah, this word moderation. I've been hearing that since came back to Conway. So I'm like, well, as long as you do it in moderation. But look, what measurement is there for moderation? What is
portion sizes and frequency? Yeah, all that goes with moderation, I imagine.
Exactly. Like I said, like the
you
portion
can eat anything that you want, you have a taste for, but as long as you do it less times or not, and the amount is not as great. I guess you call that moderation then.
Yeah. I mean, it depends on the type of food. Once again, like, that's why we get labs, because it shows, like, the doctor's gonna know what types of food you're eating. Like, I would hear Dr. McIver all the time. He was like, are you eating too much bread? Are you eating too? So they know, like, and that's
Your
super important.
cholesterol results will tell on you.
Yes, your lab
Mhm.
results will tell on you. So when it comes to that moderation definition, even though it's kind of vague, if you get those labs, they will tell you what types of, because you get those electrolytes, you get those metabolisms, like you get all that tested. So they'll let you know what food you're eating, and most of the time they'll be right, and they'll know what types of food you're eating. So
Mhm. I want to go back to something you said earlier, and it was related to the urine test, because that's, of course, one of the labs that we were talking about as well.
yeah,
And you were talking about how it's possible to drink too much water.
it is.
Yeah, and you know, people believe you're supposed to get I think the tradition or the standard has always been the 64 ounces a day, or eight ounce glasses, and 8 ounces is not 8 ounces is like that, right? And you're supposed to do 8 of those. But I saw a chart published somewhere, and it showed how you can tell if you are drinking too much water. For example, your urine should not be clear, like completely clear, like you can't tell the difference between your urine and the water that's in your toilet. And I don't know that a lot of people really understand that there is like a color chart even that kind of helps you to understand whether or not you are getting too much water or you're dehydrated. Exactly. And so the urine labs that you're talking about can actually tell you that, I guess, that you're getting too much water or not enough water. But talk a little bit about that. So in like, you know, practical terms for people who are thinking, oh, you know, am I getting too much water, or am I not getting enough water during the day?
Exactly. And that's a good point. And I'm gonna just talk about a urinalysis first.
Very good. So I was waiting for you to say something like that.
Yes. So a urinalysis.
Very good point. Yeah.
Yes, sir. So it's abbreviated as a UA, a urinalysis. It offers a rapid look at our kidney function, and once again, like our urinary tract health. So you probably heard of like a urinary tract infection. So that shows like nitrites, and that shows like lipids within your urine. It can detect proteins and glucose as well. And it can often show like early cues to infection or even kidney stones within your body. UAs can also show elevated white blood cells. And like I once again mentioned, nitrites, reflecting bacterial activity within your bladder and in the urinary system. And kidney stones play a big part into our health as well, because those do not feel good. And just to kind of just talk about what you were saying about drinking too much water or drinking not enough water. As an athlete, we were told every single day, you know, drink water. During preseason, when I was an athlete at Furman, we drank so much water and we lost so much pounds during preseason because we were drinking a lot of water, right? We weren't getting enough intake. So when it comes to drinking too much water or not drinking enough water, once again, I would consult your physician, because it just depends on your labs. It depends on your intake, on your dietary intake. So once again, it just kind of just depends. Once again, I know we talked about moderation. However, when it comes to drinking too much water, like you can tell, like with your urine, like if it's too clear, then I would kind of hold off on a little bit of urine. If it's too yellow, I would drink a little bit more water. So it's just, those tellers will certainly tell you, but consulting your provider is paramount.
So April mentioned about the clarity, and you kind of reinforce it, but the clarity of the different levels of urine. Now, I've always thought, I guess one of the doctors told me, I guess maybe 20 years ago, and also it was backed up by research as I was doing some literary research after that. But then when you have clear urine, does that mean that it didn't go through the filter and in order to get colored by filtering the food that you've eaten? If it's clear, does that exhibit a danger or something to be cautious about? And that's why, is it clear?
Well, great question. And so what we call this is like water intoxication, or like hyponatremia. So hyponatremia just means, so natremia is your sodium and hypo means below. So drinking excessive water kind of dilutes your blood, lowers those essential sodium levels, and it can cause like brain swelling or leading to severe fatigue. So just making sure that you're drinking not too much water. I mean, not all the time. It doesn't, obviously, I mean, a lot of our urine is clear if we're well hydrated. However, especially if you're on diuretic medications as well, like taking like water pills flushes out excess fluid and significantly increases urination volume and diluting its color. But as we know, that yellow color is a teller in that. So when it comes to your question of a clear urine, like if there's any dangers to it, of course there's danger to clear urine. However, like it's the amount that you're taking in, the amount of urine that you're taking in, if that makes sense. Or if it's persistent, that's super important to know as well. If that clear urine is persistent. But of course, we're always going to have, like, it's good to be hydrated. However, like I said, like anything above moderation is not good for you. So.
Mm-hmm. And I think that, to the point of this entire pathway in this conversation, when you are seeing these types of things in your daily living, sometimes you forget to even mention these things to your doctor during your regular visit. Write them down, keep a little notepad or something, or even your phone has a note keeper in it. If you're seeing a consistent pattern of things, and then that way you won't forget to mention certain things to your doctor. And I gave the example earlier of mentioning, hey, I read this, can we explore that?
Exactly.
Or if you're seeing something or feeling something, write it down. And I think that, that's also another way to advocate for yourself is to, just kind of journal or log what's going on. And in that way you can speak based on your experience. And it's not something that's just kind of like, easy to write off as you're overthinking it. Right.
Yeah. That's super important. Yeah.
Yeah.
And we call those good patients, like writing down what, like I said, like your medications, what's been going on, your symptoms, like that's super important. So that's really a good suggestion for sure.
Mm-hmm. So I want to go back real quick. We were talking about, the diet and the lifestyle medicine. Good food is lifestyle medicine. Stephanie Sessions Malone, she's one of our regulars. Thank you so much for watching tonight. She asked, what do you think about adding chia seeds and flax seeds to your shakes or vegetables? Ooh, that's a good one. Chia seeds and flax seeds are good stuff. That's good stuff.
Yes,
that's
yes,
a good
100%. That's a really good question, and thank you so much, Miss Stephanie. And I personally drink shakes. My wife makes these amazing smoothies, and we're eventually going to start putting some chia seeds in it because it's actually excellent for you. So chia seeds and flax seeds are high in fiber. They have those omega-3s that we were talking about, and they also have antioxidants as well. So they contain those high levels of antioxidants. And flax seeds, you have to really grind those. With chia seeds, they can be eaten like cold; they're a little bit smaller. However, once again, like we've been talking about, all about portion control. So starting out with a tablespoon or a teaspoon, just talking about that. So that's super important. But chia seeds, like they add really a good touch because once again, they add those nutritional values as well.
Mm-hmm. Yeah, absolutely. Yes, I'll tell you, this is great stuff. And so we talked a little bit about exercise. We talked about good food as lifestyle medicine. And just to, kind of reel it all in for those of you who are just joining us, Christian has shared with us some great information so far tonight. We started off with talking about the cyclosporia parasite that's impacting our fruits and vegetables. And he just gave us a little tidbit about what to do, which is basically make sure you wash your fruits and vegetables and really, really well before you eat them. And, look through your fruits and vegetables if you're buying bag items, or for now, just don't purchase anything right now. But the bottom line is make sure that you wash them and wash your hands as well. And then getting into the information about the labs, we were pretty much talking about why it's important for you to have your labs done, we'll say regularly, in terms of if you have something very specific going on, or if you're being treated for like chronic illnesses that require like a every 3-month duration, the labs can tell a lot. And then he introduced the idea of, also advocating for yourself, which was a question that came up from one of our audience members, and talked about and now we're talking about the importance of lifestyle medicine as well before you're actually treating things with prescribed medication. So we've gone over exercise, we've gone over good food, talk about sleep and how important how important sleep is to health.
Yes. So I actually wrote an article about this, and sleep is important because not a lot of us get it. So when I was in college, I wasn't getting, the recommended 7 to 8 hours. And sleep is super important because like
Christian, try to lean into your microphone. It's kind of hard to hear you.
Oh, you can kind of, okay. My AirPods, can you hear me now?
Just lean in. Lean in there and speak. Yeah. Okay.
Yes, ma'am. So sleep is a super important. So lifestyle medicine, you have your nutrition, you have your sleep, you have your different types of mental health, you have your stress as well. But we'll definitely talk about sleep because it's super important. So it's recommended to get 7 hours of sleep. I know I always don't get 7 to 8 hours of sleep. We have our circadian rhythm, which is like our 24-hour internal clock. And believe it or not, it has a lot to do with your health. It has a lot to do with your health. So there's different types of insomnias. I know different variances of people wearing CPAP machines. So it's super important to kind of know about like your REM sleep as well, which is your rapid eye movement. That's where dreaming occurs. Really fun fact. But it's super important to talk about that because if we're not getting enough sleep, then it throws off our circadian rhythm. It throws off our metabolism. It throws off your daily functioning as well. It can introduce fatigue. It can introduce different types of health conditions that we may not want. So it's super important to get that lifestyle medicine pillar of sleep.
Mm-hmm, mm-hmm, mm-hmm.
Yes, ma'am.
And so that's the little 3-step combination here for lifestyle medicine. Exercise, good food, sleep. It's always a good combination. And we also have another question. Should women add collagen to beverages for health? Do you know much about collagen?
I don't, but I can certainly just talk about just collagen in general. I just feel like, so collagen is essentially, it enhances bone health. I would believe that collagen would boost protein intake as well as support healthy skin and promote joint health as well. I don't think it should be a meal replacement. Collagen is more of like an incomplete protein, but it shouldn't be used as a meal replacement. However, once again, like it would provide those, like the joint health, and you can add it to hot or cold drinks like coffee or tea or even smoothies. However, just don't put it in like alcohol or anything like that. But I certainly think there are certainly a lot of benefits for sure when it comes to collagen.
Yeah, that was kind of unknown to me too. I mean, I don't think I looked at that enough to see what the impact of the collagens are.
Yes. I'm gonna have to do some research on that too.
Mm-hmm.
Yeah.
Well, this has been some excellent information tonight, Christian. We certainly do appreciate you sharing with us some, great food for thought when it comes down to what our labs really mean, and kind of giving us a little bit of advice on what to do when it comes down to dealing with this new hot item with the fruits and vegetables. But also, all of the extensions of the conversation that we had tonight were very good. And it's great to have you with us again. And so, Brother Edward, anything you want to say to Christian?
Man, just keep on. Look, each time you come on, you're like a new revelation, okay, with the information that you're coming up with. And then, I applaud you for doing a lot of medical literary research.
Yes, sir.
And I think it's everybody can benefit from that. I've certainly benefited from it, even though I do a lot of reading myself, especially when these topics come up about what the new technologies and advancement they've made regarding medical instruments or new advancements in the different cancers and stuff like that.
Yeah.
I'm just hopeful that a lot of people have been taking a notice of that and reading the same thing.
Yes, sir. Yes.
You can only hope and pray that they're doing that.
Yes,
But I think to dismiss that is negligent. Okay, I would label that as negligent when people, especially men. Okay, when they see warnings come up about colon cancer and prostate cancer, these things, I'm convinced that you don't have to die from. Okay. Yeah, you don't have to die from these things, especially when they got a lot of preventions out here. And we encourage men to get colonoscopies,
yes.
And previews and quick checkups for the prostate. That's becoming a deadly scenario here recently.
It is.
And I don't know what to say except that education's got to play an important part.
Education plays a big part.
Yeah, it plays a good part, but you got to want to at least listen to.
Yeah.
And when they're trying to educate you, if you don't, um, that kind of attitude itself stems from a lack of education. The attitude of you not wanting to listen could stem from a lack of education that you refused in the past. I don't know how to say this other than that. Okay, you gotta, you just can't be ignorant. You just can't be not wanting knowledge. Okay.
Yes, sir.
And I'm not saying that we're an expert. I'm not propagating you as an expert on this program.
Right.
But I think your literary research in the medical field is, if people have any questions, let them look it up themselves.
Yeah.
Okay.
Exactly. Yes,
all right. You can provide it. All right. Yes, and you can tell everybody what you found, and let them look it up themselves and let them make their own discernment.
Yes, sir.
Yeah.
And I'm learning. So I'm learning as we go. Like as I do these different topics, as I do these different articles, like I'm learning so much about different topics. And I'm excited to keep on writing more. But what we talk on and here, it's just a drop in the bucket to all the information that's provided on the articles. So I was super excited to just read back through it and learn how important these topics are. So I hope to continue doing. I'm just super happy. So thank you.
Well, we would like to encourage our audience to let us know what you want to know more about so that we can give Christian some leads on what he can research and bring back to us. Or either, create us articles for the magazine. And so if there's, some, conditions or, issues or concerns you have that are medically related, let us know. Just let us know and we can bring it back on to talk about it.
Absolutely.
I would love to do it. I love talking about medicine.
Yeah, there's somebody here that says knowledge is power. Thanks for all the information and insights. Do you know this person?
Yeah, that'll be my dad, and that's what you see is what you be. What you see is what you be. So just the exposure, just the knowledge, just the education is important.
Yeah,
and that goes for anything, not just healthcare. That goes for anything. So he's certainly right about that.
Yeah. Brother Ozell. Okay, man. So listen, again, I'll echo what April has said. That if you all have any information that if the audience has any information that that wants to be discussed about and talked about like that, just send us a line, and we'll see. That other McQueen that just popped up there is my brother Burrow. He's in Chicago. He's all the way in Chicago. Okay.
That's awesome.
Yeah, he's in Chicago and he's listening. Look, he's viewing. That is. So, but anyway, yeah. So, April, and for you, Kristen, this is an announcement. I'd like to take this opportunity right now and make this announcement. There's something that's happening on July 18th, which is this Saturday coming, and that's at Bethel AME Church. There's this some guest speakers to talk on life insurance, the importance of life insurance, wills and probate court, Bethel is located at 1530 Racepath Avenue in Conway, South Carolina. So I was asked to repeat that again. I mean, to make that as an announcement, and I think it's really, really worthwhile for people to know about life insurance and probate court, wills in the probate court. It's very, very important. And the guest speakers are Ms. Ruth Franks and LaShawn Floyd. Now, if you're familiar with these two people, then you can use your own discretion on that. And they get a phone number here to read, and that phone number is 843-461-5354. 5654. Sorry, for you to call. Okay, that's this Saturday. At 1 p.m. from 1 p.m. to 3 p.m. It's having a discussion at Bethel AME Church in Conway, South Carolina, 1530 Race Path Avenue. Okay, July 18th, 2026, a Saturday. Also, before that, day after tomorrow is the big day. They have this ceremony that to all the people who are even associated with Whittemore family or anybody that Mr. Willie Great, the graduate of Whittemore High School and who went on to the pros. We announced it last week, but also we're sending it out again. Went on to the pros of the Buffalo Bills. The gymnasium that he played in, which is now at Whittemore Park, will be named after him. And that is 10 o'clock this Thursday morning at Whittemore Park, gymnasium at Whittemore Park. So if you have nothing else to do, I think it'd be a good time to go and witness this, because this is going to be historic. It's going to have a plaque that will be on the gymnasium. I don't know if it's going to be placed on the door or however it is affixed to the building, but it will be on there. And they want to have a ceremony to name the building after him. Okay, the Department of Education in Horry County Department of Education is sponsoring that. So if you can, please be present. So, and also something else, the Myrtle Beach NAACP is doing a voter education, and for registration and voter registration, and this confirmation at this event on the 18th. So please be, if you could, please be cognizant of that. And they'd like for your participation as much as possible. I don't know how to say this thing like quite well, but see, some of these things that are coming in late, and you know, normally we would probably say them before or during the broadcast. Okay, so there's a Miss Tiffany Andrews who's been communicating with us on the comment lines. Indicated that, and she's the president of the Myrtle Beach NAACP, and she was saying that this will on Saturday, July 18th, from 10 o'clock to 3 p.m. Voter registration is taking place, and that's going to be at Chapin Memorial Park in Myrtle Beach. Okay, Ms. Tiffany Andrews, she's the president of the Myrtle Beach NAACP, and she'll also take the stage herself, okay, to talk about that. And I think she's a good speaker, so good listening to. All right, that's this Saturday, also at 10 in the morning, from 10 to 3 p.m. So you can kind of navigate between all the events that are happening there. All right.
So a lot going on. The NAACP has Horry County covered from Conway to Myrtle Beach with all that. With everything that's going on. That's awesome.
Yeah, that's awesome. I mean, that needs to be covered. Yeah. So, yes, July 18th, Chapin Park. One of the icons that's been displayed was that John Lewis, who always says, "Good trouble lives on."
That's right.
Yeah. So thanks, Tiffany, for that, and looking forward, and hopefully you'll have a good participation there. Okay.
Brother Edward, I typed in the comments that the Conway branches have been at Bethel. They will also be serving lunch. Received information that they'll be serving lunch at that event.
You mean for the event on the
this Saturday? Mm-hmm.
Oh, good. All right, man, there's a whole lot going on there.
Lots going on. Christian, Tiffany Andrews also posted a topic that we all would love for you to work on: menopause and menopause. Can you work on that for us?
I certainly can. Yes, ma'am.
Okay. Menopause and menopause.
Yes. Only Tiffany
There we
can
go.
say that.
Hey, it's affecting everybody. It really is. No longer just women. Menopause, menopause.
I never heard that one before.
You gotta go through something. So I don't know what you call it, but I think you go through something. We'll see. Christian's gonna find out for us. He's gonna find out for us.
Yes, ma'am.
Okay. All right. Well, Brother Edward, it has been a pleasure having
Really?
Christian on here tonight. We really
It's
appreciate
always
you.
a pleasure when he comes on. I mean,
Yes.
he brings the excitement.
Mhm.
When you make knowledge excitement, I mean that's a plus. Okay,
Yes, sir.
it's a real plus.
And we thank you to all of our audience members and commenters. Yeah, keep showing up every Tuesday night at 7 p.m. Let us know what you want to hear about. Any special guests you'd like for us to feature. We love talking, as you can see. So let's talk about it. And again, thank you for joining us. We'll be back 7 p.m. next Tuesday night. And we'll see you then, I guess.
See you
Brother
then.
Edward.
All right. Godspeed.
All right. Yes. Take care, everybody. Have a great week. Stay cool.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.